This is Mariela and the CHN marketing team.
Hi, I'm Benjamin.
I am Lulu.
Hi, I'm Olga.
And today we have a special guest, CHN's Chief of Pharmacy, William Parker.
Hello, how are you all doing today?
We're good. Thank you for being here today.
I'm excited to be here.
So, as an expert, we're bringing you in to know more about what's going on in the pharmacy world. One of the things that we've noticed is how the talk around HIV has changed. Um, we wanted to ask you, how has it changed from what it is now to what it was before?
Yes, now people have a better understanding of the disease, and it's looked at as a chronic condition versus a death sentence. With the newer treatments that are out there, we're understanding that people can live normal lives, and their life expectancy, can be normal as well.
For example, when you're driving on the freeway, you see a lot of like prep, right? Like a lot of
Yeah.
talks about prep. Could you tell us what prep is?
So PrEP is a preventative, it's a prophylaxis combination therapy for patients, not necessarily patients, people that are at higher risk of contracting HIV. And so these medications can prevent someone from contracting the disease if they're taking this on a daily basis. And so one way to curb the transmission rates across the United States is to use drugs like PrEP and programs that are associated with PrEP to minimize the transmissions of HIV. So that's a
And
good thing. They're trying to normalize that it's okay if you're taking PrEP versus being quiet about it and not taking anything at all.
Definitely, I could say that right now the way the society sees this disease is changing. Like you said, there used to be a lot of stigma around it, and people used to be, maybe embarrassed to talk about it. But now it's changing to where, like you said, it's not a death sentence anymore. It's more of a condition that you can treat, and you can still live a full life, and enjoy your life.
That's true. In the earlier days, there were a lot of unknowns, and then there were a lot of ignorance. Once things were vetted out, you had some people that didn't want to touch anyone that had HIV, didn't even want to be in the same room. They were just scared, not knowing, or just not comfortable with it. And so that has changed. We can have people around us today that have it, and we just not even know. You have combination drugs that are one tablet versus taking a cocktail of 3 or 4 medications throughout the day. And then people, why are you always going to take medicine? Things to that nature. And so it's a little more discreet, especially with the injections, once every other month. That's breakthrough. You may see the commercials that are out there. They run a lot of commercials on television these days in regards to HIV, trying to normalize and show that it's okay to talk about, and that there are treatments out there that are improving. Because you may have some people that receive a diagnosis, they go into a closet, they're depressed, things to that nature, and then they're not taking any medications. They thinking it's some of their older meds that may or may not work as well as they expect, and then it's downhill from there as far as their overall well-being, their mental well-being, their health can decline if they're not taking these medications because their levels the viral load will then increase. But you have Cabenuva. It's an injection, and it's an injection that is given once or every other month to the patient. And so they're one of the ways to qualify for it is to be on a therapy, currently on a therapy that is also a working therapy. And so basically, in a nutshell, if you're on a therapy and that therapy is working, then you can transfer to this injection versus those everyday tablets. Not worrying about taking a tablet or a capsule in the morning or at bedtime or throughout the day. Go to your doctor's office, receive your injection once or every other month, and that's it. and it's keeping the viral load down to a very minimum or to not detectable at all, which is great.
It's very impressive how the medical industry changes to where just a couple years ago, we there was no treatment, or and now we can see how people can live their life fullest with this disease. So that's just impressive. And I know that there's some medications, some treatments that can possibly reverse the disease completely. Is that true, William?
Yes, there have been cases where people are saying they are HIV free. There are still a lot of studies going on, a lot of testing, and a lot of validating. However, that is occurring. I don't have a percentage in front of me on what percentage of people that are experiencing or having that outcome, but that is happening. With that being said, people look at Magic Johnson, the famous basketball legend, and people often question him, does he have HIV? Because he is someone that we know that has it, and he looks well, he acts well, and one reason is because he is well. But he does still have the chronic condition, and so he's an icon. He's someone that we know and recognize. So we look at him and we see that he looks healthy, and so it's questioned. But that's just that's attributed to these medications that we're speaking of. If you have someone else that may be in the same room with you or work with you or someone that you know, they may be in the same condition, may have the same condition as Magic Johnson, and they may look as well as him, but we just don't know that they have the disease.
So I had a question about that since you brought up Magic Johnson. A lot of people, he looks so well because he has money. With these new drugs, how affordable is it for, the average person?
That's a great question. I'll start with there's a program in the state of Texas, the ADAP program. And so it's an HIV program that if patients that don't have full insurance, don't have the ability to pay for these medications, they're able to apply for this program and then receive their medications just for dispensing costs at their pharmacy. And so that dispensing cost is usually around $10. And so they're getting these medications that are $700 to $1,200. Even the injection, I believe, Cabenuva that we're speaking of, which is several $1,000s, is a part of this program. And so it's an extra step in applying, but applying for it, is very beneficial. And so you have affordability. And Community Health Network is an organization that is a federally qualified health center that is eligible for the 340B program, which includes discounted pricing. And those price savings are passed along to patients that are in need. And so that's another opportunity for affordable care. And then the manufacturers will have some programs that may be limited to, certain individuals within their income status, things of that nature, but there may be an opportunity for them to ship medications directly to the patient.
I was reading about, I think it was a female that got like an experimental trial done with the stem cell transplant. I don't know if you've heard about it, but if that is something that does cure HIV, even though it is experimental and I know that it's still in the works, do you think that that would be something that would be available to a lot of people anytime soon?
I would say within 4 to 5 years, it will be available to, I guess, the majority of people. Where insurance companies are accepting it at that point. Because in the beginning, it's a challenge getting things paid for. And so then it goes back to what Mr. Benjamin said, affordability. So those early adopters are those that are able to pay for those services. But I would say about 4 to 5 years. And that's the case with a lot of diseases. A lot of chronic diseases are having breakthrough drugs that are very impressive. And the pipeline, I think, is about 4 to 5 years on a lot of those being into where everyday people are receiving those medications.
Where is all this innovation coming from?
Good question. So you have the pharmaceutical companies which have been doing research for years. And one of the shifts is you have biotech companies. And so you have technology that is making a path to work in common in cohesion with the pharmaceutical companies or work standalone on treatments and therapies that they feel they can benefit America or the world with as well. And so it may be a competition or it may just be, the combination of both and where some of these organizations partner together. You have a pharmaceutical company that is doing great research. You have a biotech company that's doing great research and they really understand stem cell therapy, things of that nature, like Lulu just mentioned. And then they come together and they come together with a product that is effective and it's working and they realize that it's safe and it goes through clinical trials. So within 4 to 5 years, you see it out there.
No, William, this is great. This is very impressive that these medications are so available to people and they are affordable. So do you think with more people using the medications, would you think the overall spread of HIV can lower down among the society?
I say yes and no. There are two ways to look at it, and I don't want to be pessimistic on one way, and I'll explain what I mean. Um, in the event that these medications are being taken properly, the viral load goes to unrecognizable, and so the transmission reduces, or there is no transmission. So that's great. So that does lower the amount of transmissions. On the other hand, if people understand that we have such great therapies out here, they may not be as safe with their practices, and then transmissions could possibly increase or remain the same. I don't want to look at it that way, but it's a possibility.
So I have two questions. Magic Johnson, he was very famous. Even, my parents in El Salvador, a Hispanic country, knew who Magic Johnson was. Do you think he was one of the first ones to get all those in all those clinical trials?
That's a great question. I can't answer that as far as did he participate in clinical trials because I don't know the answer to that. But I mean, there is a possibility that he was in some early trials and trials that were effective and evolved into some of the drugs that are on the market today. And as we talk about clinical trials and these breakthrough drugs and the time frame that it takes for them to be approved by the FDA and to be on market, it's very possible that was the case.
And then the second one is going back to what you said that now because there's, for example, like there's PrEP. So someone can take it and, it would reduce or would eliminate their chances of, getting HIV.
Right.
On a show that just came out on Netflix, it's about a gay couple that after 20 years of being together, they split up. So he starts dating again. And while he's practicing you know, uh, safe sex, younger men are not. They just say, well, why? We have PrEP. So actually, they brought up that topic to the show because it said, well, you don't know what we went through so much to even get PrEP. So the fact that
Right.
you're, not even trying to uh,
Have any
practice.
responsibility.
Yeah.
That's that unfortunate part in what I was speaking on earlier, where some may be responsible or more responsible than others and take more safe practices, and then others may lean on the newer medications and the technology and advancements in healthcare and depend on it. It's a little riskier behavior, but that can exist and can occur.
Like we said earlier, you mentioned that PrEP was something that's more preventative. And for those that are at high risk, how can someone find out if they are high risk? Like, how would you actually know?
Those billboards. So that Mariella just mentioned, they're trying to advertise that if you think you're high risk, then these opportunities are here for you. And they're trying to let you know that it's okay to ask questions with your healthcare team, your healthcare providers, or the clinics that specialize in providing these treatments.
Okay. So I have one more. And this is going back to social determinants of health. Um, we do know that the poorer the, where someone lives, the less they're likely to find access to care or access to resources like this. How do you think someone that does not have FQHC, does not know about FQHC, could find care or even learn a little bit more about how to protect themselves?
That's that's true, and that's a real question because it's real that everyone doesn't know what an FQHC is, or where their opportunities are that are in hand for them, and that's where outreach is very important. It's important for the federal health centers to have a strong outreach team to reach out to these people. Whether it's their employers, it's events that they may attend, schools, um, the billboards, the commercials on television. So I think it takes a collaborative effort on outreach to try to reach these people that are in need. They have these social determinants of health, and they may not otherwise know that where they can receive treatment or a better understanding of what's going on.
I have no other questions. Is there something else you would like us to touch on, William?
No, I thank you all for your time. This has been great, great questions. Hopefully, I provided great answers, and I look forward to more podcasts with you.
Thank you. Thank you for being here. And don't forget to demonstrate your love by sharing this podcast with your friends and family or giving us a review on Spotify or iTunes. Until next time.